Good afternoon, friends. Meeting again in the session of Materia Medica, and today we're going to learn very important remedy from fourth year's class and also from CBDT, the second year class. The remedy is there, the Urtica Urens. The name itself suggests many things. This is a remedy from Urticaceae family, and it is a wonderful remedy for urticaria. Very important remedy. Generally, the whenever the urticaria comes and when it is because of the insect bites or there is a stinging type of pain, if it is getting aggravated by heat and patient is hot, then we definitely think about the Apis mellifica. If the patient is more thirstless, we think about Apis. But next to Apis, if the patient is not hot and patient is not thirstless, then another remedy having similar types of pain is the Urtica urens. It's a very useful remedy in our day-to-day practice. And it is not only for the urticaria, there are many things. Urticaria which is developed because of eating shellfish, fish, crabs, the very important remedy for that. Second important thing, it is a uric acid diathesis. Wonderful remedy for uric acid diathesis. Generally, in material form, if you give the Urtica urens in 10 drops 3 times a day, it removes specifically, it removes the crystals of uric acid from the body. That has been mentioned over there even by Murphy. He says that it is a wonderful remedy used by Burnett for such types of things. Third important thing, the gouty rheumatism and rheumatism alternating with the skin symptoms is another important feature. Here it becomes very close to Dalkamara. Very close to Dalkamara. Rheumatism alternating with skin manifestation or nettle rash. Dalkamara is one important remedy. Dalkamara, it is very specifically the cold damp weather, but this remedy you used to use anytime, and this has also have a similar type of manifestation. Fourth important point, which I used to take into consideration when Urtica urens is prescribed, the problem arises annually as this Urtica urens plant, which is called as a sting nettle, this plant has an annual appearance. Similarly, it has the manifestations which appears annually. So this is a very good remedy for that purpose. Also, I have used many times in my practice. Then I have used it for one more thing clinically, and that is for the diminished secretions of milk. This is a good remedy as a stimulant. And same remedy, if you give material form after weaning, if milk is not getting stopped, this is the remedy in material form acts oppositely. It stops the milk secretion. See, same remedy. It is like asafoetida. The way we used to use asafoetida, in the similar manner we used to use this remedy. So Urtica urens, when we use, it is the first important sentence is there agalactia. Agalactia, diminished secretion of milk. That is the first word which was used over there in this specific chapter. So these things we have to understand and we have to consider for this. And second word which he has used is lithiasis. Lithiasis is forming the stones. So very important remedy in the formation of stones. It is good remedy for gallstones. It is a good remedy for renal calculi. And it is uric acid stones, more commonly the uric acid stones, which happens to be there. So we're going to learn it from the uh, Boericke's Materia Medica. My suggestion to all of you is open your Boericke's Materia Medica and find it out on page number 661. It has been given in Boericke's Materia Medica, Urtica urens. It is stinging nettle. And this plant itself, if you touch, it has a spikes over there and it irritates. So this is very good remedy to be think of in urticaria like eruptions. So from Boericke's Materia Medica, we'll read Urtica Urens, stinging nettle, a remedy for agalactia and lithiasis. Profuse discharge from the mucous surfaces. Very important thing, profuse discharge from mucous surfaces, enuresis and urticaria. So both things which you can get over there are involuntary urination and along with that the urticaria. Spleen affections. Here it goes close with the cyanothus. Antidotes ill effects of eating shellfish. Symptoms written at the same year every time. See, very important feature. Symptoms written every time in the similar manner, yearly or annually appearing symptoms. Gout and uric acid diathesis, very, very important thing, gout and uric acid, and it favors the elimination. Favors elimination means here, when we give Urtica urens mother tincture to the patient who is suffering from gout, it removes the crystals of the uric acid from the body. So it is its physiological action which one can use in such things. Rheumatism associated with urticaria like eruptions, neuritis. Here the things are very close to Delcamara and very useful for that. So rheumatism associated with urticaria like eruptions, and it is a good remedy for neuritis, all varieties of pains. Head, the vertigo, headache with spleen pains. See, this is splenitis associated with headache and associated with vertigo. Abdomen, diarrhea, chronic disease of large intestine characterized by large secretion of mucus. So diarrhea, it is more of a mucoid nature like dysentery-like symptoms. Male genitalia, itching of scrotum keeps him awake and scrotum is swollen. This urticaria is manifested in both in males as well as females at the genital level. That's why it is a very important remedy for pruritus vulvi in females and scrotal irritation in males. Both of them, even there is a severe scrotal edema as well as labial edema is there in Urtica urens. So if it is there, one must think of other than APIS, this remedy for that purpose. Female, diminished secretion of milk, given in italics, and this is very important remedy other than asafoetida. If asafoetida fails, think about the Urtica urens. Uterine hemorrhages, acid and acrid leukorrhea, excoriating leukorrhea. It is very, very irritating. Here it comes very close to the creosote. Very irritating, excoriating leukorrhea. Pruritus vulvi with stinging, itching, and edema. So, creosote, as we know, it is the first remedy to be think of in pruritus vulvi. The second remedy one must not forget is Urtica urens. Arrest the flow of milk after weaning. Here, the physiological action you can use. You give the Urtica urens mother tincture, and you can stop the milk after weaning. Excessive swelling of the breasts. So whenever weaning happens to be there, the breast generally gets overloaded with milk and that swelling happens. In such types of cases, you can use physiological action of Urtica urens in order to stop the mm, milk secretion. Extremities, pain in acute gout, specifically pain in deltoid, pain in ankles, and pain in wrists. So gouty rheumatism, specifically of the deltoid, of the ankles and wrist, this is the remedy. Skin symptoms are more important. Itching blotches. There are big patches on the skin, itching. Urticaria, it is bigger eruptions which you can get over there on the skin. Urticaria, burning heat with formication, violent itching. I have seen this remedy is also useful in dermographism. Dermographism is a type of urticaria only where you can you write your name over there on skin and you can find it out. Yes, it has been written like this or it has been imprinted over there. So dermographism other than apis, one must think about Urtica urens. Consequences of suppressed natal rash. Rheumatism alternates with natal rash. This is the important symptom which goes in favor of Dalkamara. See, they are very close to each other at this level. Burn, burn confined to skin. Other than cantharis, one must think of Urtica urens in burn cases specifically, even for local application. Cantharis and Urtica urens mother tinctures are used, and in order to prevent the suppuration, you can use Calendula mother tincture for that. Urticaria nodosa like Bovista, erythema with burning and stinging. Dermographism is a part of urticaria in which there is a severe itching on the skin, and on the part where the itching is there, if you write your name or if you write or if you draw anything, it looks like that. You can draw a picture over there and it remains for some time. That is called as a dermographism. Erythema with burning and stinging, burns and scars, chicken pox. Dulcamara is given. Dulcamara for chicken pox, for urticaria, for rheumatism alternates with urticaria. It is very close to it. Angioneurotic edema. Angioneurotic edema is nothing but the edema which happens to be there in the throat. It is glottis which gets blocked over there because of allergic reaction. One first remedy is always the APs. Second, you must think about the urtica urens. Herpes labialis with sensation of heat and itching. So herpetic eruptions which happens to be there at labial area, this is very, very important remedy other than Restox and Dulcamaran. Itching and stinging of the scrotum. Fever, general heat in the bed with soreness over the abdomen. Fever of gout, a tropical fever. So fever is generally not so marked. It is secondary inflammation, secondary to the inflammation, secondary to the allergic condition. The fever happens to be there in Urtica urens. Modalities are very important. Must think about the modalities. Worse from snow air, water, cool moist air, and touch. So modalities are opposite to the APs. You can find it out. So in APs, you get a patient gets aggravated because of heat. In Urtica urens, patient is getting aggravated by cold air or it is aggravated by snow air. So this is big difference. APs patient is tremendously thirstless. Here, the thirst is not so marked indication for the urticaria. And third important thing, specifically eating shellfish, if urticaria develops, don't forget about the urticaria. We'll directly go to the dose because relationship, there are remedies mentioned over there. Medusal, Natramur, Laccan, Ricin, diminished memory secretion. Then Bombix, Rus, Epis, Chloral, Astecus, Pulsatilla for urticaria. Then Boletus, Luridus, and Anacardium for urtica tuberosa. Lycopodium and Hedioma for uric acid conditions, and Formica rupa for rheumatism. Dose is very important. Generally, I used to use in potentized form 6C, 12C, 30C. These are the commonest potency I used to use depending upon the susceptibility of the person. In rheumatic cases, you can go higher, even 200. Mother tincture I have not used, but mother tincture is very useful. I know. I have not yet used Urtica urine mother tincture. Generally, I used to use 6C or 12C, 30 or 200. These are the potencies I have used. So this is a very useful remedy in our day-to-day practice. One should not forget about this remedy in the practice. Must have all those potencies along with mother tincture. You can, if you there is a chance to utilize it in clinical practice, specifically in order to stop the milk secretions. This is good. Or sometimes if acute gout is there and if you want to remove the uric acid crystals, either a Berberis vulgaris mother tincture or this Urtica urens mother tincture is useful to remove the or to eliminate the uric acid crystal. So we have learned one more remedy from the fourth year syllabus as well as from second year syllabus, Urtica urens. Again, we'll meet if time permits with some small remedy. Thank you.